Chairman, and thank you for the witnesses for appearing today. In preparation for today's hearing, and I went through all your testimonies where you cite all the different reasons for rising cost in health care. There was an article in the Wall Street Journal. The headline is "Generic drugs should be cheap, but insurers are charging thousands of dollars for them." It's an article dated September 2023 by Joseph Walker. Let me read a couple of sentences. It starts out by saying the cancer drug Gleevec went generic in 2016 and can be bought today for as little as $55 a month. But many patients' insurance plans are paying more than 100 times that. CVS Health and Cigna charge $6,600 a month or more for Gleevec prescriptions, a Wall Street Journal analysis of pricing data found. They are able to do that because they set the prices with pharmacies, which they sometimes own. So, Mr. Joyner, if I could with you, for the people who are watching this hearing, can you explain the logic in charging $6,600 a month for that drug when they could get it generically for as little as $55 per month?
Yeah, Congressman, that's a very good question. And I would say back in 2023, there was what we would call cross-subsidized pricing, where the generics subsidized the brand. So it was the way in which we contracted with our clients. We've made a commitment and actually have been migrating towards a new model, which actually moves closer to the acquisition cost, which solves the problem and solves the issue that was described in the Wall Street Journal. So it wasn't the Wall Street Journal article, it was our movement to try to create more transparency, not just for the client, but ultimately moving the price and the acquisition cost closer to the consumer. So the consumer transparency is where the market has moved to, and we believe we've been the leader in the market to accomplish that.
I don't know that anybody who's watching would understand what you said, so let me ask you a different way. Would you concede that charging $6,600 for a generic drug that can cost the consumer $55 per month is not logical?
I completely agree. It's a lot, but I would just say that from a client contract standpoint, we create a significant savings for the clients, and that is why, and that's what prompted the push towards now moving to consumer transparency. And again, as a leader in that push, we believe we've actually solved the problem on behalf of the consumer and the clients.
Mr. Chairman, I'd ask that this Wall Street Journal article be submitted for the record without objection.
So moved.
Mr. Joyner, if I could, let me ask you a different question. Let's assume that we have an Aetna insured, and she walks into a Minute clinic to get treatment, and her prescription is filled by CVS Caremark. Can you walk me through the cash flow on that?
It would work very similar to how healthcare works today. And I would say from a coordination standpoint and from a consumer experience, we have basically taken the process, the scheduling, and the logistics out of the consumer's hands. We've actually improved the way in which they're able to access low-cost healthcare, which is the Minute Clinic. It is a low-cost retail acute clinic setting to deal with cough, cold, and flu. And then now they have the convenience of getting a prescription next door. So from a customer experience, completely better than what exists today by having to go to potentially 2 or 3 different settings in order to get the same treatment for the flu and or for some virus you may have.
Got it. Walk me through the cash flow from the time that the payment hits Aetna all the way down the chain in that scenario.
So Minute Clinic would charge their service, although that is contracted with the client. So as we look downstream, we offer no-cost plans to our customers. So in some respects, it could be zero for the consumer to go to a Minute Clinic. And because now we are actually also prescribing, we were migrating to very low-cost products. So this would include the highest generic dispensing rate, which actually is, in many respects, less than $5, $8 for the medication. So it's a really value-oriented transaction, and I think the consumers have really positive experience with our Minute Clinic, and they have very positive experience with the pharmacists feeling like they have a care team that is focused on their health and focused on getting them healthy for, for the conditions they have.
I'll let the consumers see if they understand what you just said. Thank you very much. I'll yield back.
Gentleman yields. Ms. Moore.